So welcome to HiNZ 2018, and I'm here talking with Kevin Ross. And Kevin is General Manager of Precision Driven Health and the Research Director of Orion Health, wearing a couple of different hats, right? And you've given a talk, is it today? Was it today that you gave on this partnership success that Precision Driven Health has had? Kevin, tell us about it.
Sure. So Precision Driven Health is a partnership between New Zealand's health IT community, universities and health providers, basically doing data science towards personalisation of health. So it was founded by Orion Health, Wairemata District Health Board and University of Auckland, kind of recognising that we have some unique strengths in New Zealand to analyse data, to collect really good health data and actually to put that into practice in a way that can be much more effective treatment for people as patients, but also more effective use of resources within the system. So in the talk, I really explained some of the work we've had underway. We've been around for about 3 years. We're a $38 million program over 7 years. So we're about a third of the way through the partnership research program. And we've supported about 50 projects to date. So all of those projects are some variation on a clinical person recognises an opportunity to improve someone's health. They have some data available. So we put them together with a data scientist or a software engineer or a team of those sorts of people to analyse data, produce a tool, see how it might help predict someone's outcomes from health or their propensity to follow the advice they're given or different types of things that will be useful for actually directing the sort of care they get. And ultimately it's about collecting that data, analysing the data and then turning that into tools that can be used in practice.
Is it things like machine learning, or is that any of those components, artificial intelligence?
Absolutely, yeah.
So is it using all of those sorts of aspects of the technology?
So machine learning is a core part of what we do, and machine learning really is all about just trying a lot of different statistical techniques to analyse data. So a lot of the work we've focused on is what's unique to health in the use of machine learning. So one of the things that's quite different, if you like, about health is that someone's profile is not just one type of data. It's a letter that they received as a referral, plus a scan that's got some image information, plus a lab result, plus the history of someone's medications. And all of those are quite different data types. Mm-hmm. And in health, you've got this mix of quite different data. So you've got text data, you've got pictures, you've got quantifiable numbers. You try to combine those. And so we use machine learning to essentially summarize this patient in some sense and then say what patients are similar in a sort of a mathematical sense to other patients or to the patients that I'm seeing today. And what can that tell me about, for example, the likelihood of them developing a particular condition, or the likelihood that if I discharge them from the hospital that they'll come back again, or all the sort of outcomes that we know are both not very good for the patient and also not very good for the health providers themselves because they're expensive and they sort of indicate either a safety problem or an efficiency problem or something that hasn't quite worked.
Is there any influence from an international experience that's brought to bear on what you're doing in New Zealand, or is you working mainly with New Zealand cohort of data?
Yeah, so we're primarily driven by New Zealand opportunities. However, we're utilising the fact that Orion Health has 100 million patients around the world on systems that Orion's developed, and so we're sort of using that sort of global network to understand what different health systems' needs are. But we're sort of doing a lot of the work in New Zealand. There are some examples where we've got data from international cohorts that's more easily accessible, so we've done the research based on international data, but primarily we're trying to tune it into New Zealand's context to make it valuable for our own health system in New Zealand. The partnership model is really all about trying to deliver both health benefits for New Zealand and also commercial opportunities for the IT community. So thinking of New Zealand as a really good test bed to actually develop new technologies. New Zealand's got fantastic data in health. We've got digital records that go back 20 years that you can confidently say that this is this patient who was seen in this context. We've got world-leading data science, particularly the University of Auckland's background developing tools like R that are world-leading statistical analysis tools. So we're sort of seeing that health data and data science as unique New Zealand contributions that if we bring them together in the health space, there's some really exciting opportunities.
So if you're working with Wairemata District Health, so if you're talking about 20 years of data, so do you then have access to private sector information? Let's say if a patient has been seen privately and publicly. Where does that fit into the
Yeah, so
machine learning?
So there's quite a lot. Yeah, so New Zealand has quite good administrative systems for collecting data, whether it's from public or private. So one example is a project we've done on predicting the outcomes from surgery. So in that case, we were able to look at all surgeries in New Zealand, regardless of whether they happened in public or private, because they're required, even if they're delivered in private, they're required to report on certain outcome information. So we compile that information in one place and then do the sort of analysis on that. Now, in reality, as things move forward, you'll get more and more examples where you've got some data but not other data. And actually, you still have to be able to make recommendations. You know, our doctors don't get to say, well, I've got some missing information, so I can't tell you what to do next. And so nor can our technology. So you need to build technology that can handle missing data. It needs to be able to handle the fact that sometimes devices go down and don't have good data. So one of the interesting themes that's evolved through the machine learning work is that you can't wait until you've got perfect data. You have to say, this is what is available. What do I do next? And so that's quite a theme to the work we're doing, is interpreting the results so that we can understand them, working out what to do when data is missing. In health, for example, missing data is often a positive outcome. So if the patient doesn't come back, that might mean they got better. Doesn't necessarily mean that, but that missing data is relevant to the situation. And so there's all sorts of nuances around when you actually get into analysing the data, what that might mean.
Now, if you're working with Whitemata, right, as a partner, so is the results or of the various projects, have they been made available to any of the other district health boards, or they?
Yeah, so Whitemata are our core sort of governance partner, if you like, but we are working with other district health boards. So one example, I mentioned surgery outcome calculators before. So that's one where we've actually put on a publicly available website the calculator that we've developed, which is basically based on all of New Zealand's data. These are the outcomes that you expect from surgery. So it's now available to all district health boards in New Zealand. Some are becoming sort of available broadly, others are sort of uniquely in one place, but it's sort of a project by project discussion, but we're trying to see the benefits out to New Zealand as effectively as possible.
Did you mention that website in your paper, your presentation, the publicly available?
I don't know if I got into the details of it.
No,
It's being presented elsewhere, but it's called New Zealand Risk. Is the name of the website, and it's something you can link to from precisiondrivenhealth.com, which is our website where you can hear about all the different projects.
That sounds interesting. I'm sure people would be interested in following up on that. Kevin, thank you very much. It really is a really well thought out, and the partnership, it really sounds exciting. So the best of luck with it in the future. Thank you very much.